We want to thank our sponsors, Creative Artist Video Production, for all of your video needs. Snellville Heating and Air, serving Monroe and Walton County since 1988, for all of your heating and cooling needs. And Creative Signs. No sign is too large or too small for Creative Signs.
Hello, my name is Anita Peters with Peters Realty Professionals in Loganville, Georgia, and I have some beautiful homes to share with you today. Information deemed reliable but not guaranteed. Some of the featured homes are HUD properties, and any registered HUD agent can show and sell you a HUD home. Thanks so much for watching.
What we do to the planet, we do to ourselves. You can help keep America beautiful. Visit KAB.org.
Dr. Craig Mines, orthopedic surgeon. Go for it, Dr. Mines.
Well, thanks everybody for coming out tonight. Has anyone in here had a hip replacement? Okay, so there's the new way and the traditional way. So most people have hip replacements in this day and age. The incision is made towards the back into your buttock. And this talk is about we'll say a kinder, gentler way to do a hip replacement, where there involves no muscle cutting and a lot less pain and a lot quicker recovery. So people who've had hip replacements can definitely understand what I'm talking about, because they hurt after, and this kind of takes care of a lot of those problems. So this is about a surgery that is much better, easier for the patients, but a little harder for the doctors. So that answers the question I always get, well, why doesn't everyone do this? Because it takes some special training, it takes some special equipment, and it takes, a lot of effort on the doctor's behalf to kind of master this technique. It's just not what we were trained to do originally. Now, this technique has been around in Europe. We've been experimenting on Europeans for a very long time now. So it's been mastered there, and now it is slowly working its way into the United States. About 50% of hips in Europe are done through the anterior approach, whereas only about 2% in the United States. But last year it was 1%, so each year it's going to continue to grow. Why do you have a hip replacement? Well, hip arthritis. Hip arthritis affects hundreds of thousands of Americans every year. So it is a debilitating, painful condition that really inhibits your ability to have a quality of life. Essentially, you can't walk, you can't get up from certain seats, you get stuck on low seats, you're stuck on toilets. So there's a lot of activities of daily living that are affected by people's ability to live their lives that are affected by their hip arthritis. And we'll talk about why people choose to live like that versus have an operation to get rid of it. We talk about how people alter their lives. I mean, my patients always come in there, I don't go shopping anymore. I don't like to go out. I don't play with my grandkids. I don't do this. I don't do that. And it's because they're suffering, but the options aren't there for an easier solution. And now they are, and that's what my talk is about, to try and bring that to life. First and foremost, when do you have a hip replacement? Well, I always tell my patients when everything else has failed. Surgery is the last resort, not the first. Medications, the traditional ones are the Motrin family of medications, NSAIDs, non-steroidal anti-inflammatories. Physical therapy can be very helpful. Other things like occupational therapy, teaching people to do different things. Something simple as getting a higher toilet can really improve someone's quality of life if they don't wish to proceed with surgery. Assistive devices, it kind of goes from walking normal to walking with a single cane, a quad cane, a walker. And then some people, will end up in a wheelchair because their hips are so bad rather than have an operation. But if these don't work, hip replacement surgery is an excellent alternative. The reason why it's one of the biggest successes in orthopedics. The goal of hip replacement is to reduce people's pain and improve their motion and quality of life. About 350,000 hip replacements will be done in the United States this year alone. And that's going to go up by probably fivefold in the next 20 years because we're going to have a lot more older folks with hip arthritis out there. America's getting older, and this operation is going to become one of the most common operations, which it already is in the United States. What is a hip? Well, people understand it as basically a ball and a socket. The ball portion of the joint is on the top of your thigh bone, called the femoral head, whereas the socket portion is called the acetabulum and is part of your pelvis. And the femoral head, like I said, is the ball at the top of the thigh bone, and whereas the socket is what holds the ball on the pelvis. What is arthritis? Well, it's when the nice good cartilage on the top of the ball, kind of up in here, wears away. And it wears away for various reasons. Typically, when we think of arthritis, we think of it as wear and tear. Well, research has kind of showed that it has a lot to do with the position of your hip, the depth of your socket. So we've heard of, babies born with their hips dislocated. Well, there's a variant of that, or a lesser degree, where your hip socket's just not very deep, but it isn't dislocated. If you have less of your tire on the road, or your tire's out of alignment, it's going to wear faster. Same thing as your hip. So if you know people in their 30s and 40s who have bad hips and need hip replacements, it's probably because they had unrecognized hip dysplasia, where the socket just wasn't ever formed deep enough to hold the whole ball. So that's a new problem that it's an old problem that we're now realizing is happening. We used to kind of just blame it on arthritis, but probably less than 50% of hip replacements are just because of genetic, my hip wore out kind of arthritis, or osteoarthritis. We talked about the cartilage wearing down and the bone roughens. When the bone roughens, it gets irritated, and irritated bone makes more bone. Bone spurs. So then you get a rougher joint that just tears up all the other stuff around it. A hip replacement is where we actually take the ball off of the thigh bone, implant a new ball, and then change or shape the socket side to accept a metal liner, put a liner into that metal liner, and then put the ball back in there. So the parts and pieces of a hip replacement are demonstrated here, whereas this portion is what goes into your thigh bone. Right. Think of a round tube, and we can actually chisel in a rectangular shape. You put a wedge-shaped rectangular into a round tube, it's going to stop eventually. And we actually go ahead and nail this into place. We'll bang on it with a 5-pound hammer if we have to. But it becomes part of the bone once it's nailed in there. Now there are other variants. We used to cement them in. Well, now we nail them in because research has shown over the years that they're much more stable and more likely to last a longer time if your body will actually grow into them. And they're coated with certain materials that bone likes to grow into. So again, research improving people's quality of life. On that stem we have the neck, and on that neck goes the ball. On the socket side, we take the not so round socket after it's worn out. Think of a round or a hemispherical, half of a ball shaped cheese grater on a drill, and turn that oblong socket into a perfect hemisphere or half circle. And then we'll take a slightly larger cup and bang it in there. And that cup usually is hitting there so hard that it actually will grab onto the bone and it's stable. Into that cup goes a liner, usually made of plastic. There are other options like ceramic. The balls and the stems are usually made of steel, sometimes titanium. The balls can be made also of ceramic. Ceramics are, think glass. But what they are is bioengineered materials that are actually smoother and harder sometimes than steel. They have some of their downsides. The downsides is they're more brittle. They're more likely to actually crack than a steel head. But they're smoother, so the benefit is that you have less wear. So kind of the gold standard in America right now is a steel head on a plastic liner. It's moving towards a ceramic head on a plastic liner, and that's usually what I use in my patients. We had experimented with other materials, steel heads on steel liners, and I always tell people in medicine, there's nothing like time to ruin a good result. So if you hear about on TV, have you had this hip replacement, call this lawyer. And that was a metal on metal hip that had a design flaw in it that unfortunately only time brought out. So that hip got recalled. Now it doesn't mean we took them out of everybody, but it means we really needed to look closer at patients who had those because there was an increased number of failures of the operation expected. Unlike a tire recall, there's a lot more to getting your hip changed out than there is to a tire. So, anything can have its downsides. These are mechanical devices, and they do have their limitations. and we are putting them into living people whose bodies change over time. We used to tell folks when I first trained that the life expectancy of a hip was 7 to 10 years, 20, 30 years ago. Well, those hips are still around. So now we're telling people 20 to 30 years. So for a lot of folks choosing to have a hip replacement, the hip lasts longer than you do. So I did a 92-year-old on Tuesday, and she was concerned about how long this was going to last. And I told her, I think 25, 30 years, and if it wears out before you do, I will replace it for free. Of course, I'll be retired and she'll be 120, but we'll deal with that when it comes to that. The acetabular component, or the socket side, again, is drilled with a hemispherical or rounded shaped cheese grater into the socket to shape it, and then hammered into place. It can also have some screws that go through the cup into the bone to further lock it in place if somebody's bone is a little softer. So I get that question a lot of times from older folks who, I have soft bone disease or osteoporosis. We can work around that as well. If people have softer bones and we don't get the bite of the bone we like with the cup, we'll just put some extra screws in there to further fix it. And that's also been shown over time, and medicine is really based on research. You go back and you look at how things turn out, your mistakes, and you try not to repeat them. And you find the things that work. And sometimes we've learned that putting a screw in actually enables hips to last longer because you get better fixation initially, so the bone grows into the cup a little better. So they last longer. We talked about the liner of the socket, and that just kind of snaps in or fixes itself into the metal liner. And in this day and age, it's most of the time plastic. Ceramic is becoming more popular, and the metal liners are kind of falling out of favor for various reasons, especially when you see the lawyer ads on TV. So total hip replacement is when the femoral component, or the ball side, is changed out with a stem and neck portion and a new metal ball. As I said, the femoral heads are made of metal or ceramic, and the stem is hammered into the thigh bone, which is a tube, think paper towel tube, that is shaped to accept a square or a rectangle. So it locks in to the round tube. And the way we do that is we don't drill it out, we actually will crush the bone to shape the inside, which leaves a lot of bone that grows into and stabilizes the implants. Okay. It's one of the most successful operations we do. In my practice, I do a couple hundred of these, and I would say 98% of my hip patients are fairly happy. 1% I probably could have done something different, and you probably know the other 1% you can't make happy no matter what you do. So it's a fairly successful operation. If you hit 98% in baseball, you'd be the world's richest guy at that. With newer materials, we're now, as I said, telling people hip replacements can last up to 20 years and even beyond. We used to think they were good only for 5 years, and those are the hips I put in as a resident 20, 30 years ago. Well, we're still seeing those people back with the same hips. So they lasted a lot longer than we ever expected. The traditional approach to hip replacement is, like I said, an incision from your behind. Okay, it goes from the side of your hip into your buttocks. The downside of that is it disrupts the buttock muscles, which are important for both walking as well as the stability of the hip, which leads to some complications with traditional hip replacement and also increases the time that it takes to recover. It involves detachment of muscles to bones and usually requires a larger incision, up to about 8 to 12 inches now. I think 12 to 18 inches is a little long, but that's where we started. Whereas when you do it from the front, and I'll show you this, you use a much smaller incision. This is the anatomy of the backside of your tushy, where we do the, and this is the muscles we have to go through to get to your hip, which is why it hurts so much after.
Isn't that why there's a lot of blood?
You lose a lot of blood because we're cutting through muscles, which is another benefit of anterior hip replacements. You tend to lose a little less. The other reason you lose blood is, where is blood made? It's made actually inside your bones, the bone marrow, and you're drilling a big hole into that big bone, and blood can come out during the operation. So another important fact to understand. The other thing people don't understand, and you can see, if your hip socket lies underneath these muscles that are pulling that way, that's what kind of holds that ball in the socket. And hip dislocations, especially when done the traditional way, has been kind of a thorn in the side of this operation. It's a well-known complication, occurs in about 3 to 5% of people. I think it's very surgeon dependent, but there is certain patients that it occurs more commonly. But the one thing we know is when it's done with the newer way, people don't dislocate their hips anymore because you preserve these important muscles rather than disrupt them. The traditional approach done through the the buttocks muscles, again, we talked about the risk of dislocation, the limitations on hip motion. You just had this operation, now they tell you not to sit in low seats, not to cross your legs, not to lean forward, and you have to wear a pillow between your legs for a while. With the newer way, you don't have to do any of that.
Oh, good.
Because your hip will not dislocate. So there's also a risk of a persistent limp. People have had a hip replacement will tell you they limp pretty good because the muscles we have to go through are the muscles that help you stand on one leg. Well, nobody thinks they stand on one leg, except for every step you take. Every step you take, you're on one foot. And if the muscles out here are weak, you get this, what we call Trendelenburg gait. You fall away because those muscles have been disrupted or injured, and they're not as strong as they used to be, so that leads to an inability to hold up the other side of your body. So you fall away from your bad hip. So you walk with this lurching gait. I call it the waddles in my office. So there's a greater reliance on assistive devices. So you kind of had this operation so you wouldn't need an assistive device, but studies show that done through the posterior approach or through the buttocks, you're more likely to end up continuing to use a cane for reasons I explained about detaching these muscles and weakness of the muscles and damage than if you have it from the front. And it's an over 6 week recovery, whereas the newer approach, we tell people under 6 weeks. And often my patients are walking unassisted now through the anterior approach hip replacements at about a week. And a lot of them leave the hospital walking, they don't even get wheeled out to their car, they just kind of go out and carry their walker. And I'll show you why after this. Also, this operation done from the posterior approach versus the anterior hurts more. People use more pain medication. Pain medication has its own downsides. Sometimes the pain is better than the pain. It makes you constipated, it makes you nauseous, it can make you vomit. Who wants to vomit after they just had their hip replaced? So anything we can do to make it more comfortable for the patient leads to vast improvements in the outcome of their operations, which to me is their satisfaction. Are they happy after we did it? If people are happy, I'm happier. Okay? The traditional approach leads to people wanting to delay having hip replacements. They're willing to suffer longer because they're afraid of having a surgery that hurts and has a prolonged recovery and that has well-known complications that go along with it. So all of these factors make people hesitant to proceed with a hip replacement. Then they continue to live in pain. There's a newer, kinder, gentler approach to this. And this is called the anterior approach hip replacement. The anterior approach is coming from the front of your hip. Think of it more as a zipper rather than a cutting operation. The approach is from the front. There's no disruption of the muscles. There's minimal trauma to the surrounding tissues. You don't really do a lot of cutting as much as spreading things apart. Think of opening a zipper. There's minimal, it's a muscle sparing approach, and it's done through a much smaller incision, 4 to 5 inches rather than I said 8 to 12. In the front of if you think about where your hips are much closer to the front of your body than they are to the rear. There's a lot less stuff to go through. The other thing that lends to the success of this operation is your front muscles all go straight up and down. And then I showed you on the anatomy of the back of your hip, they go a lot side to side. So you got to cut through them, whereas in the front you can just spread them apart. And then all of a sudden, you make a decision kind of right in the front of somebody, and you're looking right at their hip just by pushing the muscles to the side. This is a cross section. Right here is the ball and the socket. And what I like to show you is just compare the depth of the tissue you have to go through. Here's your buttocks. Here's your belly. So you can go right in that line, right there, through the separation in the muscles. We've all seen an animal or beef cut apart. There's certain cuts, and those are separated by we like to call it the grizzle or the fascia in medicine. So it's almost like a zipper. You just come right here and you're right into the hip. Whereas here, there's no plane to go through. The other thing is when you go right through the middle of a muscle, you're going to damage it, and you can damage the nerve supply to it, the blood supply to it, and you end up with a lot of scar tissue, which goes into why people persistently limp after the surgery. How is this done? This is a medieval torture device we got from the Middle Ages. Now, this is called a Hanna table, and it's a specially designed piece of technology that allows us to do this operation through the front and through a smaller incision, as well as keeping us safer. It helps us get the bad stuff, your femoral artery and nerve live in the front, out of the way. And what this table specifically does is it will pull traction on your leg, which will allow us to get the ball out of the socket, and allow us to turn your leg safely so that the ball is now pointing out of the surgical incision. So instead of bringing the surgery into the hole, we bring the part out of the body. And we can do the surgery instead of having to look at the entire thigh bone. I'm just looking at the top end of it. So you're looking down the tube rather than at the tube. So that's how we get it done through a much smaller incision. Now, this table is available here at this hospital. Why is it not available at every hospital? It's about a $100,000 item. So there's not a lot of hospitals you can convince to invest in this sort of technology, and it's great that our hospital, Clearview, has made that investment in the community. The other benefit, when you do a traditional hip approach, you do the patient lying on their side, which inhibits your ability to x-ray during the operation, which is why one of the other complications of traditional hip replacement comes about, leg length inequality. It's hard to get people's legs at equal lengths if they're lying on their side and they're kind of all balled up, but that's the only way you can get to their bottom. Whereas in that table picture I showed you right before, these people are laying flat and there's nothing really underneath their hips. So we can wheel in a motion picture x-ray machine and watch the operation while we're doing it. Rather than wait till they get to the recovery room and the incision's all closed, the dressing's on, take an x-ray then and go, oh my. That's never what you want to hear. But that's one of the greatest benefits of this operation that I've found, is precision. You can see the mistake before you make it. You can correct it before the patient has to live with it or have to have another operation. So that is really a plus of this operation, anterior hip replacements. A small amount of x-ray, a motion picture x-ray machine, is used during the surgery to get an exact picture of the position and alignment of these implants. If you can see it, it's hard to put it in bad. You know it right then, you just change where you're putting it. This ensures that all the components are placed in a perfect alignment and position, and that the leg lengths are equal. Sometimes it's hard to guess on the leg lengths, and if you're struggling because you've gone through the rear and the hip is unstable, you keep adding length until things tighten up. Then you end up with a leg that's an inch long, and now you're telling the patient they need a shoe lift on the other side. This stuff doesn't happen now with hip replacements done from the front. The benefits, like I said, it has an essentially no risk of dislocation. They've done studies and looked at thousands upon thousands of these, and the dislocation rate is none. They haven't seen one. The limitations on hip range of motion and position after the surgery don't exist. Go ahead and move your hip, put it behind your ear if you want. It's really hard for me to get it out of the socket when the patient's asleep on the table. You can't get it out when you're awake and your muscles are tight. So it's an incredibly stable operation because you're not disrupting those important back muscles that hold that ball into the socket. Less reliance on assisted devices. I'd say on average, my patients by 2 weeks aren't walking with a cane anymore. They're not limping, and they're very happy they did it. I couldn't say that before when I did the traditional approach hips. There's less pain and a faster recovery. Happier patients is what matters. Ultimately, these advantages, when compared to the traditional approach, can eliminate that apprehension that makes people want to live with that pain and suffer longer. So what I'm doing, hopefully with this talk, is spreading the word that there is a better, a kinder, a gentler solution to that pain in your hip, and that you can have the operation maybe earlier than you wanted to, because the recovery is not as bad, it's more reliable, and a lot of the problems that you've heard about and worried about in the past are now reduced or eliminated. And I always tell patients, no one comes with a manual. God hasn't dropped your manual on my desk to do your operation. So it is practice, and you have to get good at this operation. There's a learning curve to it. The first ones I did took a lot longer than the ones I do now. There was more blood loss.
How long does it take? How long does it usually take?
I did 3 this week. They were all under 2 hours.
Okay.
Okay, and that's on par with an average traditional hip replacement. First one I did took 8. The guy taught me to do them when I went to his hospital and watched him do 20, 30 of them, and then we used cadavers or anatomy specimens and practice, and the companies will help us do these things so that they make sure that you're using their devices correctly and that everyone ends up with a good result. And you don't see those lawyers on TV calling them. I mean, he's doing them in probably an hour and a half. Some of them, people who do thousands of these do them in an hour. Again, a lot of it has to do with the setup and the takedown. I mean, that is a pretty extensive setup on that table. Not much different than setting up a traditional hip replacement because you got to turn them on their side and use a special table to hold them in place. But it's on par. It's not a shorter operation, it's just a better one. Okay? So ultimately, the important thing is you get a quicker recovery and you return to an improved quality of life. And that makes my patients happy, which ultimately makes me happy. Again, my practice is called Georgia Orthocare, right? I'm going to leave you cards. Actually, you have them. She has them.
I have another question.
Go ahead.
I'm sorry, I had one on my right side, it has to be replaced.
So you need a revision. That's what we call a second do.
Because it's defective, whatever.
Okay.
And I've got to have one down on my left side. The pain is getting out of control again.
Right.
So I want to do this side first, but I really want to do this procedure. 'Cause I've had
The revision or the
the
regular?
one you were just talking
Okay,
about.
so this is, at least in my hands, a better operation right now for what I call a primary hip replacement, the hip that hasn't been replaced.
Right, we'll do that one.
There are people who do revisions through the front as well. I'm not there yet. I think maybe I do another 50 hips this way, I'll feel comfortable doing that. The other downside of having it done from the rear and then going to the front is you leave an area of, say, muscle and tissue that can be devitalized or not healthy. And you can end up with some wound healing problems. The revisions through the front is much more, we'll say, cutting edge than this. This is definitely an accepted standard way. There's not a lot of us still doing revisions or redos through the front. But if you were my sister, I would tell you to have it from the front. That's the only way I would let my sister have it. Yes, ma'am.
My question is pretty much like hers. You may have already answered it by that revision, but I've got 3 screws in my hip, and I'm going to have a total.
Okay.
And I guess that would be called a revision.
Well, no, not necessarily. If you just have screws, say because you had a hip fracture,
It broke.
right, it broke, and then they screwed it back together, and
Yeah.
obviously it didn't heal the way it was supposed to, because now you need a hip
Well,
replacement.
it may be that. It may be the fact that the arthritis and the bone spurs have
Gotten better, right? You never
gotten
know.
worse
But-
with my
right.
age, so that's.
All you need is to have those screws taken out and a new hip put in. When we talk about a revision, we're talking about we've already cut the ball off and we have a socket in there. So there's been a lot of bone that's been lost, which makes it a much more complex operation. What you're describing is harder than just a run-of-the-mill hip replacement, but doesn't really put you into the higher risk categories of a revision and the problems that go along with those. So I wouldn't worry too much. And as a matter of fact, you can have an anterior hip replacement with taking the screws out. We did one a couple weeks ago. So it's not uncommon after you break your hip and you get those screws in, whereas the ball blood supply dies, then the ball goes on to die after, and you get arthritis and bone spurs and stuff. A well-known sequelae or side effect of breaking a thigh bone. So especially in a younger person. When that ball cracks, the blood supply to the ball comes up through the shaft of the bone, takes a turn on the neck, and then goes into the ball. If you crack that, the blood supply cracks with it.
Yeah.
And there's a fine line between how much crack you can accept or deformity, how much you let that bone move, and whether that ball lives. And it's a fairly predictable thing. And now research, you learn from your mistakes, is telling us that a lot of those people, young people who have femoral neck fractures, are actually better off with a hip replacement that lasts 30 years than a hip pinning or screwing that lasts 5.
I knew that after I had it done, but
Right.
that was too late.
Right, but there's not a lot of doctors now who are buying into that yet. Like anything else in life, you learn from your mistakes, and we're going to get better at it. And maybe your daughter or my kids would benefit from the trials, and that's what we call medicine, trials. Essentially, these are mistakes. but you don't know because you don't come with a manual. If you came with a manual, and this was Midas, I'd stamp lifetime guarantee on your head. But this is hard. I mean, this is hard stuff. And when Tim operates with me, and he hates me when I do these because I'm a bear. I'm stressed out. It's not routine as doing the old way. It's a harder operation. But I know after I do another 20 of them or 30, every one of them gets easier, and I get more relaxed and more comfortable with it.
Well, then, there's hope that I can get a.
No, you're going to do great. Well, no, the one thing I can tell you about hip replacements is people love them after, and they don't take long to get over, as long as you don't have problems. And there is 2%, like I told you, of people who end up with a problem after a hip replacement. But there's a lot less of that, probably 0.2% after an anterior hip replacement. The only real complication of doing it from the front is people complain of some numbness around the incision, which I think they have in the back too. But it can bother you more in the front, I guess, because you don't rub your bottom as much as you rub your front. And that's been one of the documented, because there's a skin nerve that goes kind of in that area. And not everybody's exactly the same, but you can get it when you go through the skin. You can't see it, but if you injure it, they'll be numb right around their thigh. I guess people don't like that. So, that's really the only complaint I've ever heard. So, the hospital, the other thing I don't think I said in my talk, the hospital stays are a lot shorter too. Most people, when they have their hip replaced, stay 3 to 5 days, with an anterior 1 to 2 days.
Hello Walton County, this is Kevin Little with the Chairman's Report. Happy New Year 2014. It's been a long time since I've been on TV for a while. I had several events I had to attend and couldn't get on TV and show you some things that was going on. I want to talk to you just a little bit about Hard Labor Creek and the water system in the county and give you a little idea of what we have in store for the future and what's going on. Behind me is a water system of Walton County, which, as you see, the Monroe area here, they provide water service to everything inside this area. Social Circle provides water service down here, and Loganville up here. All the rest of the unincorporated county is responsible of the Walton County Water Authority and Water and Sewage Authority. And what we're doing is Hard Labor Creek is going to be built right here. I've been showing that to you a lot. And we have some main systems already in place to be able to pump the water once it's taken care of. The water system, the orange will be a big loop that we'll be building around the county to enhance the system to where it'll be able to go to get enough water pressure to the residents that are living out in the unincorporated area. And then we already have the water main line that goes into Oconee. And then we'll have another water mine that'll bring off of Appalachia River the raw water, which will be treated and then sent around the county. And so this is some of the future that we have. All the current blue and purple lines are water lines that we have in place. Some of them may have to be upgraded as time goes, but as you can see over here on the western side where the majority of our growth has been, we have a lot of water units there, and then out in the Gratis area you have some, but as you get out into the Good Hope, Jones Woods, and that area, you don't have a lot amount of water lines. And so as this is the most rural part of the county, and this will enhance it with the trunk lines that we have there, and we'll be able to get water around the whole county. That's one of the big goals, is to be able to have water. I know we've had a very rainy 2013, and 2014 may be dry, and so having water is very important. Through the years, people's wells have been drying up, and they'd call and ask when we're going to get water. But we're closer than ever now with the governor's water initiative and able to get that money to build Hard Labor Creek. And we're in the process right now of figuring out the water lines, what we need to do first, and get everything going like that. But I'll be talking to you probably about every week or every other week here on Channel 16. If you have any questions, give me a call, 770-267-1301. But I'll be updating you on several of the major events that's going on in the county over the next few weeks. Thank you.
Hi, this is Cindy Little. I'm the Executive Director of Fish for Kids, and Fish Medical and Dental. We have grown a lot over the last few years with adding our medical and dental clinic. That is doing exceptionally well, and we're just able to help a lot of sick folks that have really been in need, and we're able to help them maintain that good health once we get them there, and so that's been a blessing. Our Fish for Kids program is really growing, as well as because now our Backpack Buddies program has grown to over 1,200 children a week, and we're also doing 3 different schools that we help with the after-school snacks. The Fish program at the ministry, which is with the food and utility and rents and all of those kinds of things, and helping with clothing and all, has there too doubled almost due to the need for food, with the food stamps being cut. And we just found out at the Farm Bureau convention I was just at with my husband, who's a farmer, that they're fixing to cut food stamps again. So I don't know what our elderly especially are going to do, but fortunately we're there for them. The fish thrift stores are just blessed abundantly with wonderful, wonderful donations. All of this is great, but we need help. We really need the volunteers. If you can give an hour a day, if you can give 1 day a month, or whatever you can do is deeply appreciated and needed. All you need to do is just call over to the thrift store here in Monroe and ask for Nancy Long. She is our volunteer coordinator, and her number there is 770-207-5601. And if you would just call Nancy and let her know you're interested, we'd love to have you. If you have a church home that you're a regular participant with, then we usually can put you right to work. But we do have to do background checks on everybody because of the amount of young people and children that we let volunteer, which is a great thing. But we also want to protect them, and we have a lot of special needs young adults that also volunteer with us that we want to protect and make sure that everyone that's there is someone that they want to be around and not to be afraid of. There are just some situations that we have to, with our insurance as well, go through these things, and it's unfortunate, but that's what we have to do. So we would love to have you to be a part of the Fish family, and I guess right now the greatest need is that we need folks in the thrift stores helping with sorting. And if you've got any kind of managerial or sales, marketing, or anything like that, or if you feel like you'd be a good pricer, we need you. Or good on the cash register is always another good place to be. The ministry, we need folks answering the phones. The phones are ringing off the hook. We need folks helping stock the food, folks to help fix the food boxes for the families. Fish MD is in need of dentists really, really bad. We have like a 600-person waiting list right now, and we also need folks at the medical and dental to help answer the phones, to do intake, and anybody with any medical background that could help us with setting up appointments and doing scripts and things electronically. If you can draw blood and have been in that kind of environment, we'd love to have you. If you're an EMT, a nurse, a CNA, or anything like that, and would love to come help us, we'd love to have you. If you're a doctor, we really would love to have you. We're really blessed with some great docs right now, and we have a nurse practitioner. So if you a nurse practitioner also, we would love to have you. So we just thank everybody that we are where we are because of the wonderful volunteers and everybody giving of their time. So God bless you, and thank you.
Good morning. I'm Becky Chinhall, Radon Educator with the University of Georgia, Walton County Extension Office. And I'm so glad to tell you about Radon Action Month. January is National Radon Action Month. And even though I tell you to test your home all year long, and I promote radon testing, radon awareness, radon education every month of the year, January is when we emphasize it more than any other. The Environmental Protection Agency has designated January as the time, and I'll tell you one of the reasons is when we have this cold weather, we tend to have our homes closed up more than any other time, and there is a chance that your radon would be even higher during January, during some of this weather. So any time is a good time to test your home for radon. but January is a great time. We try to have more programs, special emphasis on radon. I hope you'll hear about radon on the radio, on your television, and I hope you'll encourage your friends to test their homes for radon if they have not. One of the things that we do is we let children, students, enter the radon poster contest, and we promote that, and we announce the winners in January. And I'm so pleased to share those with you. And I want to tell you that Walton County had 2 out of the 3 state winners. I'm not talking about county winners, the state winners. And these students are going to be recognized next week by Georgia Governor Nathan Deal at the Capitol when he signs a radon proclamation. This radon proclamation says that everybody in the state of Georgia needs to test their home. The first place winner for the state of Georgia is from Oconee County, and his name is Hayden Guthrie, and I want to show you his picture, his poster. We're very proud of him. And I want to tell you about our second and third place winner. Our second place winner is Tyler Haymans. Tyler is a 7th grader. He's from Monroe, Georgia, and he attends Georgia Cyber Academy. And Tyler's poster says, "Not all scary things go bump in the night. Have your home tested for radon." And I want to say congratulations, Tyler. We are so very proud of you. Then I want to tell you about our third place state winner. And her name is India Gibson. India is a 6th grader, and she's at Youth Middle School. She's from Covington, Georgia, and her poster title is the National Radon Hotline. We are so proud of India and so proud of our students in Walton County. Tyler and India, congratulations, and we look forward to seeing you next week at the governor's office. These students have worked hard to create radon awareness. They've done that with their posters. They've let their parents and family and friends know about radon. And when we publicize and show these posters different places, more and more people will learn about radon and will want to test their homes. And I just want to tell you a little bit about radon. It's a radioactive gas. It comes from the soil and the rock. Walton County is one of the higher counties in the state of Georgia for the potential for radon. We have a lot of granite rock here. Most of that granite is from Stone Mountain. And granite has uranium. Uranium decays into radium. Radium decays into radon. It's naturally occurring, but it can be deadly. Radon is the 2nd leading cause of lung cancer. It's the 1st leading cause of lung cancer among non-smokers. You need to test your house if you have not. It's easy to do. We have radon test kits here at the Walton County Extension Office, and I'd like for you to come by and pick up a test kit if you have not tested. Test kits are only $8. That covers postage, that covers laboratory analysis, and the cost of your test. So it's a great deal, and you mail the test kit in after you've tested. You get your results back in about a week. EPA recommends that you take action if your test results should be 4 or higher. So 4 is kind of that magic cut-off number. And of course, the lower your radon, the better. I want to show you one other poster as I conclude today. And this is one of our national winners from several years ago. This was the first winner of the National Radon Poster Contest. And we still use this poster to publicize radon testing. And it says, "Don't take a chance on radon." And that's what I want to end with today with you. Don't take a chance on your family's health. Go ahead, test for radon if you have not. Thank you so much. Have a great day, and come see me at the Walton County Extension Office.
Hello, I'm Kenny Sargent with Keep Walton Beautiful and the Walton County Recycling Center, and want to thank you all for tuning in today. I did want to talk about a few things going on down here. We just wrapped up our Christmas tree recycling, Bring One for the Chipper, and we were very pleased with how it went. We had a lot of Christmas trees down here, and I really just wanted to remind any of you that may have never heard of that event, that we do it every year, and it's a good place to bring your Christmas trees this next Christmas if you're looking for a place to take yours. They're brought here, and we take them and make mulch with the Christmas trees, and it's been a good success for us. Some other things going on. We've had people that's asked some questions about the hours here, and as you may know, on Saturdays we're open 7:30 to 1:45, and through the week we're open 7:30 to 3:45. And a lot of people ask, well, why don't you just close at 2 on Saturday and close at 4 on during the week instead of the 3:45 and the 2:45? But the big thing is our 8 hours is up at 4 o'clock during the week and at 2 o'clock on Saturday, and it takes us about 15 minutes to close everything down, to count down the tickets, to get in here, shut everything down, and clock out. And we're not wanting to be here over our hours at all. So we do need that time to get things closed down and get out of here, and that may be hard for some people to understand, but we do the best we can. We don't take lunch breaks here. We're open through lunch, and we are open on Saturdays. And I would also remind you that generally on the weekends and throughout the week, our convenience sites are open a little later than us. Now, the only disposal they do is the green bag disposal in the compactors, but they are open for recycling and the green bag disposal. So some of your needs may be able to be met by them. Some other things going. I did want to remind everyone of some of the things we recycle here. There's been some questions about what all we do recycle, and I just wanted to remind you that any of these items that you have, we recycle here. We would be happy to have you come down and see us. We'll walk you through the place, show you what we do, show you where it goes. That's why we're here, and we want to educate people to know what we do and why we're doing it. But here at our center here, we take aluminum cans, number 1, number 2 plastic, office paper, corrugated cardboard, newspaper, magazines, household batteries, car batteries. We recently started with the cooking oil, and we also take automotive oil, transmission fluid, gear oil, tin cans, trying to think of the glass, and we take all of that here. We also take tires. For the smaller regular car and light truck tires, they're $2 a piece. For the bigger truck tires and so forth, they're $6 a piece. On those tires, there can be no rims on the tires. That is for the tire only, and that is pretty much what we have available here to recycle. And I did forget electronics and computer components. We do recycle those here, and it's actually a very safe recycle. We get a document destruction on all of those items, so you can rest assured that what you bring here may be confidential, is destroyed, and it's not able to be used or pirated by anyone else. That's just about all I have here. I would remind some of you, maybe you're Boy Scout, Girl Scout, Cub Scout leaders. We'd be happy to have any of your troops in here for a program to talk to the kids about the importance of recycling and conservation. We could give them a walk through the building. Again, that's why we're here, and we'd love to have you. We do programs here, and that's what we really enjoy doing is making sure that everybody in our county knows how seriously we take all of this and what all's going on here. To give you an idea of some of the things going on in our county. That's about it for now, and thanks for tuning in. We'll see you next time.
Hi, and welcome to this week's edition of The Health Story. My name is Dee Dee Harris, Executive Director of Walton Wellness, a nonprofit located in Walton County dedicated to the prevention of lifestyle-related chronic illness. Today, I want to talk to you a little bit about the power of a positive attitude and also a little bit about the health power of prayer as well. It's the beginning of the year. We just went through the holidays. Hopefully you had a wonderful Christmas and a great New Year. And a lot of times after those holidays, and especially at the beginning of a new year, sometimes we can feel a little let down. And sometimes it's also winter time and it's been very cold. And so a lot of time those things can tend to kind of dampen our attitude. They often can make us feel a little depressed and just kind of affect our mood in general. And those of you who may have made New Year's resolutions and want to stick with those, and you want this to be the year to actually make whatever it is happen, you really need the positive attitude. So we can't let the environment around us, the cold weather, all of those things try to affect our mood that then can affect our health. There's been a lot of research done by real scientists and real doctors looking at what is the health effects of having a positive attitude. Now there's a mixed bag of outcomes out there if you research this yourself, which I always encourage you to do, but you will see there are kind of a mixed bag of answers. What is actually the effect on our health from a positive attitude? And some people say, some of the research where it has looked at people that have some kind of very major terminal illness or something will say, well, they had a positive attitude, but it didn't affect the outcome. However, some of these studies haven't looked at the quality of life that that person may have had before the illness actually took over them. So it's important to see what you want to look at as well. What type of quality of life? Now, most of us fortunately aren't dealing with a major terminal illness, and so let's look at the power of a positive attitude just on our general wellness and health. And that is where you can see a lot of difference there. With people who actually keep a positive mental attitude, they tend to have lower stress levels, lower blood pressure, are just overall kind of healthier. A lot of times they can bounce back from a cold or some type of illness that they get a lot quicker than people who maybe don't have as much of a positive attitude. Now there's lots of things that they've looked at too. A lot of times people with a positive outlook on life tend to lead a little healthier lifestyle. They sometimes tend to exercise more, and they tend to have a little healthier diet. But it's the age-old question, which came first? Maybe they had a positive attitude and that helped them go out and exercise and have a healthier diet, or maybe they did that first and as a result it became a positive attitude. Either way, the research does show that a positive attitude can help you in your health and wellness. It can also help you in recovering from some type of illness or surgery or injury. Along those same lines, there's a lot of research done on prayer and spiritual meditation as well. And there are a lot of really positive results that they have seen that basically they are willing to say people who pray or meditate are healthier people. It kind of goes along with the same lines. Those of us who are spiritual people and we pray, We tend to do that hopefully on a regular basis, but also very importantly, we pray probably more when we are ill or someone close to us is sick, or maybe we have been diagnosed with something, or we're wanting to work through some kind of major problem in our life, which has shown that what happens with prayer and with spiritual meditation is that your mind and your body relax, and you are able to, first of all, clear your mind a lot more. You're able to make better, more positive decisions for what direction you want to go. And you're also able to have a peace about whatever decision that you choose. And so I am always fascinated by this kind of research, because obviously me as a Christian and I do pray regularly, do believe obviously that it does help with my health and well-being, and also with just my own mental attitude and having a positive attitude. I think it all kind of works together. It's always fascinating to me, though, to think about the mind-body connection. There are so many instances where our mind, if we really focus in, can help us in our physical health and our well-being. As always, I encourage you to look and do some research of your own about these topics. You can find some very interesting articles out there that I think that you would like. And as always, if you want to find out more information about us, check us out on the web. We are waltonwellness.org. We have all kinds of tools on our website that I think you'll find helpful, and also all of our contact information. Thanks for watching.
Hey, thanks for tuning in today. As usual, we're going to show you some of the dogs and cats that are here at Walton County Animal Control. You know, we really like the winter time because it gives us a little bit of a slowdown, and amazingly, the shelter isn't full of cats right now. But you know, spring and summer are right around the corner, and we start getting in just tons and tons of cats and puppies. So we really need your help to get your pet spayed and neutered. Maybe there's some cats that have been hanging around your house. You don't mind them being there, but you know what? It'd be a good idea to get them spayed or neutered. That way you don't have to bring in litters of kittens to us in the spring. And we want to tell you about a deal that's going on right now. It's for Walton County residents. They're doing $25 spays for cats. So you can get your cat spayed for only $25. This is through Pound Puppies and Kittens Rescue, and you can call them at 770-972-5067, or look on their website, which is ppnk.org. And so help us out. Maybe you've got that cat, you've been wanting to do it. Well, now there's no excuse. Only $25 to get that cat spayed. You know, like I said, we enjoy this slow time where not as many animals are coming in, but every springtime it just breaks loose again. So help us out, do the responsible thing as a pet owner, and get them fixed. Maybe in this new year you want to get a new pet for your house. We're going to show you now some of the dogs that are here at the shelter. Just come on down and have a visit.
Today we have this beautiful Walker Hound. We don't get these in very often, so now's your chance. And it's a boy, about 1 year old. Good pet.
Got a little female puppy. Can't tell it by her, but her mama is actually a boxer mix. Looks a lot boxery. I'm not sure what the father is, but she's the last puppy of her litter, and she's about 2 months old.
A hound mix male, about 1 year old, looking for a good home. He's really sweet. Got a lot of energy.
Hey, you can't miss this one. She is a gorgeous yellow lab, maybe mixed with a little bit of golden retriever. Really, really sweet girl. She'll make an excellent family dog. She just come in, and maybe an owner will come looking for her, but if not, she'll need a new home, and this will be perfect for your family.
This is Miley. We have her listed as a Beagle mix and 1 year old, and she's got such a beautiful pattern on her. Who can resist her?
Here we got a female Chihuahua mix. She's about 1 year old. She's not spayed. She seems to be very, very friendly. Just needs a good home.
Hello, my name is Anita Peters with Peters Realty Professionals in Loganville, Georgia, and I have some beautiful homes to share with you today. Information deemed reliable but not guaranteed. Some of the featured homes are HUD properties, and any registered HUD agent can show and sell you a HUD home. Thanks so much for watching.
We want to thank our sponsors, Creative Artist Video Production, for all of your video needs. Snellville Heating and Air, serving Monroe and Walton County since 1988. For all of your heating and cooling needs,